Listening activity number 13. You'll hear a dialogue between a foreign student and a student union officer. As you listen, answer the following questions.
Good morning. Can I help you?
Yes, I'd like to know something about the British medical scheme.
Yes. What's your question?
Can I use British doctors if I fall ill?
That will depend on how long your course of study is. If it is 6 months or more, then you are entitled to treatment from the British medical scheme, called the National Health Service, NHS, as if you were a British citizen. With the NHS, consultations with doctors are free, but you will be asked to pay something towards the cost of medicines. In 1987, this is £2.40 for each item of medicine. You are also entitled to free treatment in British hospitals. Always make sure the doctor knows you want treatment from the NHS, as doctors also take private patients, who pay the full cost of all their treatment.
How do I make sure I can be treated by the NHS?
If you are eligible for treatment, that is, you are registered on a course of 6 months or longer, then the first thing you should do is to register with a doctor. You should register with any doctor close to where you live. Local post offices have lists. All you need to do is visit the doctor or the doctor's receptionist during consulting hours and ask to be included on the doctor's list of patients. If the doctor decides to accept you, you will then be sent a medical card by post, which will carry your National Health Service number. Take great care not to lose this. If the doctor cannot accept you, try elsewhere or contact the local family practitioner committee. You can get the address from the post office or any doctor. Find out your doctor's consulting hours from the doctor or the receptionist and ask whether or not you need to make an appointment before seeing the doctor. Remember to be on time for any appointment you make. You can see him or her during those hours unless you are seriously ill. If you are seriously ill, the doctor can be called out to see you. Once you have registered, you should tell your warden, landlord, landlady or a friend the name, address and telephone number of your doctor, so that if you are suddenly taken ill, the doctor can be called out to see you.
I see. Could you tell me something about British hospitals?
Yes. Hospitals provide specialist treatments, or treatment for which any kind of extended stay is required. Your doctor will recommend you to go if it is necessary. Casualty or emergency treatment following accidents is free for everyone. As not all hospitals provide such services, you should find out which local hospitals do, in case you ever need treatment.
How about dental care in Britain?
You can find lists of dentists who give National Health Service treatment at local main post offices. You do not register with a dentist, but you should ask whether they are willing to give you NHS treatment, as dentists are free to accept or refuse patients, and to provide private treatment only. If you are accepted, you should give the dentist the NHS number which is on your medical card. There is a charge for all dental treatment. For basic treatment, this could be up to £17. More extensive dental treatment will cost more if you are not registered with a doctor. You will have to pay the full cost of dental treatment as a private patient. You will have to make an appointment to see your dentist and should give notice if you are unable to attend an appointment, or you will be charged for loss of time. You should try to have your teeth checked at least once per year by the dentist. From the NHS, you are entitled to a free 6-monthly checkup.
Thank you very much. This helps me a lot.